Welcome everyone, I'm Matthew Reynolds from the Continental Training Academy. Today we'll be going through the application of physical intervention skills in the private security industry. Welcome everyone, today we're going to explore the application of physical intervention skills in the private security industry. We aim to understand the implications of using physical interventions, recognizing the risks associated with these interventions, and the methods to reduce those risks. Let's start to understand physical interventions and their implications of their use. In this section, we'll examine the legal framework governing the physical interventions. So it's crucial for anyone in the security industry to understand that the use of physical force is legally permissible, but only under specific conditions. So let's dive deeper into the laws that frame our actions. The key pieces of legislation include the Criminal Law Act, which allows the use of reasonable force for the prevention of crime, making a lawful arrest, or defending oneself or another from harm. Additionally, understanding that actions such as trespassing also have legal implications which can justify the use of reasonable force under UK law. So trespass is a civil offence which is committed by a person who is improperly on someone else's property without permission. If any person has an honestly held belief that he or she or another is in imminent danger, then he may use such force as is reasonable and necessary to avert that danger. And we'll talk about what is considered reasonable and necessary later on. The Criminal Law Act gives everyone, including door supervisors, the authority to use such force as is reasonable in the circumstances in the prevention of crime or in effecting or assisting in the lawful arrest of offenders, suspected offenders, or persons unlawfully at large. And a person may use such force as is reasonable in the circumstances to prevent a breach of the peace or to save a life. Our duty of care is a legal obligation to ensure that the actions we take do not harm others. This is closely linked to the principle of non-pain compliance, which means that any physical intervention must not inflict pain or harm unnecessarily. These principles must guide every decision that we make in the field to ensure that our intentions are lawful and ethical. Principle of non-pain compliance and application is not to breach human rights. So that's the freedom from any torture. When a physical intervention is employed, you must be able to justify its use. So key considerations include whether there is a genuine need to use the force, whether that force was proportional to the threat, and whether it stopped as soon as the threat is contained. Each use of force must be reasonable, necessary, and justifiable under the circumstances that are presented. Key questions to consider. Was there a need to use the force? Again, if there is no need to use force, then you simply don't do it. What was the size and build of the injured party compared to the user of force? So those who are larger than you and taller than you are likely going to be more stronger. So that means you might need to use more force. But if that person is smaller, then it's very likely you wouldn't need to use such force in the same circumstance. And at what stage did the person stop using the force? So once that threat has been neutralized, the use of force either needs to end or it needs to be reduced significantly to avoid any injury. Was the force applied in good faith or in a malicious way? So the intent of the person applying force is critical. Last resort of physical intervention can increase risks of harm to staff or customers and result in prosecution of staff if the force was unnecessary or excessive or in any other way unlawful that leads to allegations against staff and potentially loss of license and employment. So last resort means that any other options have failed or are likely to fail where necessary to prevent harm and it's not possible or appropriate to withdraw. In scenarios where harm must be prevented and no alternative is viable, physical intervention becomes a last resort. Examples include preventing immediate harm or in situations where withdrawal is not possible or safe. Understanding this helps to ensure that physical interventions are used legally and ethically. A good way of justifying the use of force is to use other options, such as conflict management. Have the words that you use to talk them down worked? If not, you're going to need to use physical intervention to deal with the situation. Sometimes the situation means it's not possible or appropriate to withdraw. So if that person is violent and continues to be violent, then you must maintain physical intervention to reduce that risk to yourself and to others. So how do you justify using force? The reasonable application of force requires awareness of the facts and the circumstances of each particular situation, including the severity of the crime at issue. So whether that suspect poses an immediate threat to the safety of others, and whether the subject is actively resisting arrest or attempting to flee the scene of the crime. There is no specific definition of reasonable force, so it solely depends on the circumstances. If you only did what you honestly thought was necessary at the time, this provides strong evidence that you acted within the law. It's all about that justification. So you do not have to wait to be attacked before defending yourself. However, you could be prosecuted if, for example, you carry on attacking the intruder, even if you're no longer in danger. So it's when did that force stop? And to pre-plan a trap for someone rather than involve the police. So it's that malicious intent. Using physical intervention has significant professional implications. So there is sector-specific legislation and standards that must be adhered to. Misuse of physical intervention can lead to professional misconduct charges, legal consequences, and financial liabilities. So it's essential to stay informed of all legal obligations and professional standards in your area of employment. For professional guidance and standards, you need to look at your own employment, your own organization where you're currently working. What are their standards for the use of physical intervention? Ethical implications are about doing the right thing. So were the force used in the right way? Financial implications include cost to fines, cost to people being off work, training new staff. This is for both you as a person and the organization that employs you. So if you've used force in the wrong way, in an illegal way, then there is potential you'll get fined for that, and that will have other consequences such as you losing your job, being investigated, having time off work. So there is also those financial implications you need to consider on top. And again, last resort, just think about what would happen if you didn't use physical intervention. Have you tried alternative methods first before jumping straight into using physical intervention? So controls are split into primary and secondary controls as positive alternatives to using physical intervention. So physical intervention should always be a last resort. So primary controls are proactive measures, such as following policies and using security technology effectively, whereas secondary controls involve interpersonal skills and conflict management techniques that reduce the need for physical interventions. The whole idea is primary and secondary controls would mean that you don't need to use physical intervention. Primary controls are about prevention. So to start with, we'll be adhering to employer safety and security policies, ensuring that we follow the safe working procedures. Other primary controls are using security equipment like CCTVs and radios. And this helps for us to summon assistance, get support, and deter the need for physical intervention in the first place. We can often prevent situations from escalating that need physical intervention from arising by maintaining a proactive service delivery. So always remember the best conflict is the one that is prevented. Secondary controls involve employing effective interpersonal communication skills. These controls are crucial as they help to reduce the need for physical intervention by de-escalating a potential volatile situation through communication, through dialogue and understanding. The idea is if we have good conflict management skills, then we wouldn't need to use physical intervention in the first place. Now, what are the differences between defensive physical skills and physical interventions? So let's clarify two important concepts. Defensive physical skills are used to protect oneself from assault. They are reactive measures. In contrast, physical interventions involve applying force to restrict another person's movement and are used to directly manage and control conflicts. Defensive physical skills are skills used to protect oneself from assault, like breakaway techniques. Physical interventions are the proactive use of direct or indirect force through bodily, physical, and mechanical means to limit another person's movement. So the idea there is to use that physical intervention. You are the person initiating the force. Restrictive interventions can be highly restrictive or low-level restrictive depending on the situation's needs. They involve using force to limit a person's freedom of movement, which can include bodily contact, mechanical devices, or environmental modifications. So it's critical that these measures respect the legal standards and are only used when absolutely necessary. Highly restrictive are about using force that restricts and greatly restricts limbs to prevent individuals from throwing their arms out, punching, striking, that sort of thing. And you need to be highly restrictive to control those limbs, preventing them from causing damage. Low level restrictive is simply restricting the movement of an individual, but using less force and using or restricting fewer limbs. It gives that person greater movement. Non-restrictive interventions offer more freedom and involve minimal physical contact. Techniques such as guiding or prompting an individual are used instead of force, allowing the person to comply voluntarily. So this approach is preferable and it aligns with the principles of non-pain compliance and minimal force. You should now be able to understand what physical interventions are and the implications in using them in the workplace. As security professionals, understanding and managing the risks associated with physical intervention is crucial. These risks can be physical, they can be legal or ethical, and can have long-lasting effects on all parties involved. Physical intervention must always be considered carefully with full understanding of the potential consequences. These interventions should only be used when absolutely necessary and when less intrusive measures have been considered or attempted. So the nature of the restraint or the method of restraint, maybe to risk of falls with restrictive holds, the position held and the duration of restraint will increase and decrease the potential of injury. The risks involved with physical intervention extend beyond the immediate physical dangers to include potential legal consequences if the force used is deemed excessive or inappropriate. So you must also ensure that your actions are defensible and justified within that legal framework. So situational factors such as the setting and location, constraints and risks, so as an open or confined space, the environmental hazards, staff numbers, availability of help, access to medical attention, or even the threats presented by others will determine the best use of physical intervention going forward. It's important to continue to assess and reassess the necessity and proportionality of physical interventions, taking into account those individual factors such as their age, the size, their weight, the physical state, the medical conditions, exhaustion, recent ingestion of food, alcohol, drugs, mental health, history of violence, prior experience. All these individual factors would help you to determine what is the most appropriate use of physical intervention to use. You also need to consider vulnerable groups such as children and young people, older adults, or individuals with mental health issues. And the reason for this is because of their understanding of what is going on. So, within a complex situation, you need to think about, do they understand the situation and the severity of what is going on? And even if they're carrying any injuries, children are going to be weaker. They're going to bruise easily. They're going to be more vulnerable. So we need to consider techniques which are less forceful. Even with older adults or people with individuals with mental health issues, we need to consider their needs as well. So that could be their health issues, that can be any injuries they have, any illnesses, and that would affect the way we use conflict and potentially the way we use different techniques for physical intervention to avoid making any injuries worse. Acute behavioral disturbance, or ABD, refers to a combination of physical and psychological symptoms that can quickly escalate and may require immediate physical intervention. So this is always on your exam. So it's really important that you recognize for signs and symptoms to identify signs of acute behavioral disturbance. ABD is significant because it can present complex challenges for intervention. So these disturbances may require dynamic risk assessment to manage it safely and effectively, considering the rapid escalation and high intensity of the following symptoms: high temperature, bizarre behavior, sustained mental and physical exhaustion, and increased metabolic acidosis. Now, this question is always on the exam and it's part of the PI Q&A. So it's important that you recognize these signs and symptoms, because if it's not managed properly, there's a good chance that the person you are putting physical intervention on could die. So it's critical that you are aware of the signs and symptoms. Psychosis can be a critical factor in situations requiring physical intervention. Symptoms can include hallucinations, paranoia, extreme fear, or part of delusional beliefs. So, when you're dealing with individuals experiencing psychosis, it's vital to employ non confrontational approaches. And these individuals might misinterpret actions due to delusions or hallucinations. So, calm, clear communication and de escalation techniques are essential. Again, psychosis will be covered in your exam and definitely within your PI Q&A. So, it's important that you recognize and remember the potential symptoms of psychosis, which include hallucinations, seeing things, paranoia is that believing things are there, and extreme fear as part of those delusional beliefs, so they're acting irrationally. So both ABD, acute behavioral disturbance, and psychosis can result in sudden death. So it's really important that we monitor and manage the person's well-being. So if anyone's complaining of struggling to breathe, then we must stop physical intervention. So remember, when it comes back to the use of force, at what time did we stop applying the force? Positional asphyxia is a critical concern during physical restraint. So it occurs when the position of a person's body interferes with respiration, potentially leading to serious injury or death. And this can happen if someone is restrained face down or in other positions that restrict breathing. The risks of positional asphyxia are grave, so including the possibility of death or permanent brain damage due to oxygen deprivation. So avoiding positions that compromise a person's ability to breathe is essential in all physical interventions. To manage these risks, always choose the least restrictive form of intervention necessary. Monitor the individual's breathing continuously, avoid high risk positions, and adjust or cease the restraint immediately if breathing becomes compromised. So, key risk factors for any positional asphyxia include the method of restraint, the position of the restraint, and the duration. Any restraint that involves force, especially when exerted on the torso or in a prone position, dramatically increases these risks. So, try to avoid PI on the ground. Try to use methods that don't compromise breathing and circulation, and try to get individuals into a seated position so they can continue to breathe properly. Positional asphyxia typically occurs during forceful restraint resulting in weight or pressure on the torso. So, whilst all forceful restraints on the ground carry heightened risk, the technique used will increase or decrease the risks of positional asphyxia. And this is why your method of restraint is critical. So, the position being face up or face down, or on the ground, or any other surfaces such as a bed or a seat or standing position, where breathing will affect the risk with positional asphyxia. So, an ideal situation, this person will be standing with no pressure on their breathing, on their respiratory systems, their circulation systems. The longer a person is held in a position and method of carrying heightened risk of positional asphyxia, the longer their exposure to risk and subsequently potential for harm, including death. De-escalation should always be your first strategy. If an intervention becomes necessary, continually assess the situation for any signs of distress and be prepared to adjust or stop the intervention to reduce harm. So the longer the duration of forceful restraint, the greater the exposure to risk and to complications leading to death. People have been prosecuted because they haven't reduced that force quick enough. Not only are there risks to individuals from suffering from positional asphyxia when they're on the floor, but think of the risks to you and to the other person from potential further assault. So, at the earliest opportunities, you need to take physical intervention off the ground. Restraint-related deaths are most common during ground restraints, and this is specifically where an individual is held forcefully face down on the ground. But it could also occur when the individual was held forcefully face up on the ground or bent forwards in hyperflex seated restraints. And the reason for that is the pressure that is placed upon the respiratory system to prevent breathing, which prevents oxygen being moved around to the body and, in particular, the brain. As you can imagine, any impact with the floor or objects during forceful takedowns can cause significant injuries, including fatalities. Again, the floor is probably not going to be clean, so there are potential for injury from glass or any debris that's actually left on the ground, particularly with that person that's actually fallen on the ground, and then that object has then gone through that person's body. And the problem with being on the ground is then you are vulnerable to assault from others. So this is why it's essential that at the earliest opportunities, we try and move physical intervention off the floor into a safe position. And for these reasons, avoid physical intervention on the ground wherever possible. Ensure that you monitor that person's safety, monitor their breathing to ensure they're still showing signs of life. But remember, if you need to, you'll need to start CPR or use defibrillator as soon as possible, and as soon as it's safe to do so, get to feet as soon as possible. You should now be able to understand the risks associated with physical intervention. Physical intervention falls underneath health and safety law, so we need to look at how to reduce the risks associated with physical intervention. When managing physical intervention, it's critical to monitor the person closely for any risk factors, both situational and individual, ensuring that nothing restricts the person's ability to breathe or their circulation. So always check their breathing, their airway, and the circulation, the ABCs of first aid. If you're working with teams, always ensure one person is designated as a team leader who's responsible for the safety of the individual. That means that one person can sort of concentrate on that individual's safety, checking their breathing, checking their airways, ensuring they are safe at all times throughout. During an intervention, if a person is conscious, can speak, maintain a dialogue with them. Take their concerns seriously, especially if they indicate difficulty breathing, as people can still speak when experiencing breathing difficulties due to positional asphyxia. It is law. Ensure that you de-escalate force at the earliest opportunity and immediately. So the longer an individual is held in a particular position, the greater the risk to them. So at the earliest opportunity, you must de-escalate the force. ABD and psychosis are serious conditions that can result in death. And also, any serious injury or death can also result from strikes and kicks. The impact from an individual falling or being forced to the ground will increase the potential for harm. Any interventions involving the use of the neck, the spine, or vital organs, which are prohibited by the SIA, are likely to cause serious injuries to the individual. Restraint on the ground or other position that impairs the breathing and circulation will increase the risk of death through positional asphyxia. Any forceful restraint can lead to medical complications, sudden death, or permanent disability, especially where situational and individual risk factors are present. To simply reduce harm, you need to choose the least forceful intervention practicable. So, what are you trying to achieve? What is the least forceful way of achieving that? Avoid high-risk positions, including your ground restraints. Do you need to use such force? Avoid high-risk methods of restraint, such as neck holds, that will adversely affect breathing or circulation. Maintain ongoing communication between the staff and between staff and the subject during and following that restraint. Ensure that we are proactive in the subject's welfare. So continue to monitor the person's well-being, checking if they can breathe, checking if they're okay. Working as a team and designated team leader, ensuring that you split responsibilities to reduce the risk to yourself and then to reduce the amount of force needed by each person to ensure that physical intervention is used appropriately, keeping the subject safe. Adhere strictly to established procedures and guidelines during physical interventions. Deviations can lead to increased risk of harm and legal liabilities. So regular training and reviews of these procedures ensure that they remain effective and relevant. At the first opportunity, begin to de-escalate the use of force. So if the person involved in the intervention complains of discomfort or shows signs of distress, immediately release them and provide necessary assistance ensuring their safety and well-being. If at any point during the situation escalates to where the person's life may endanger or they show signs of severe distress, release them immediately from the restraint and call for emergency medical help. Dynamic risk assessment is a critical tool in the security industry, so it allows us to continually assess the threat and risks of assault to staff and harm to others when deciding whether to use physical intervention. So you must continuously evaluate the situation throughout the physical intervention. Before going ahead with physical intervention, you need to assess that threat and the risks involved to all. That's to yourself, to your colleagues, and any others. And that should help you to decide whether or not you need to use physical intervention. Now, physical intervention is all about your justification. So evaluate your options. Do you actually need to use it? And once you've decided, inform that decision to others, whether to intervene, when, and how. It's all about taking that lowest risk. You need to identify when assistance is needed. And generally speaking, you should look at contacting backup before you start physical intervention, because if it gets out of hand, you're going to struggle to contact for support if you are preoccupied dealing with another person. So keep monitoring changes to those risks, changes to behavior, changing to people's health during and following an intervention. At some point, you need to de-escalate the use of force and to withdraw. So at that point, you need to communicate what you're going to do and when you're going to do it. In managing a physical intervention, prioritize the person's safety. So continuously monitor for any change that could increase that risk of harm. So observe fully the risk factors, and that's to the individual and to the situation. Also, don't forget the environment. Remember your ABCs, checking airway, breathing, and circulation. So ensure that nothing impedes the subject's ability to breathe or their circulation. So if something happens at individual during physical intervention, then you're the one responsible for that person's welfare. At some point in your career, you'll come across an individual who has made a turn for the worst. So the person is unconscious. Go back to your first aid skills. If this person is unconscious and breathing and has no other life-threatening conditions, you simply place that subject in a recovery position and seek assistance. If that person is unconscious and not breathing and showing no signs of life, then you need to commence CPR immediately. And in an ideal situation, that person is breathing and is conscious. So talk to the subject and listen. Take any of their concerns seriously and act on those concerns, especially if they were talking about their health. So if they're advising you they are in danger and you ignore that, then potentially that's going to open up a can of worms for you in the court of law. You need to be vigilant for red flags such as difficulty in breathing, sudden changes in behavior, or signs of extreme stress. So these indicators require immediate action to de-escalate and, if necessary, disengage to prevent severe outcomes, including positional asphyxia. Red flags include anything to do with breathing, vomiting, consciousness, loss of responsiveness, facial swelling, anaphylactic shock, hallucinations, bizarre behavior. So if your subject exhibits any of these, then it's critical that you reduce and stop physical intervention. If an emergency arises, the priority is to ensure the safety of all involved. So implement emergency procedures by disengaging and providing necessary medical attention. Always call for emergency services when a situation escalates beyond safe control or when severe health concerns are evident. Following any physical intervention, it's imperative to carry out certain responsibilities. These include providing care to the subject, ensuring that that person is safe. You've also got a duty to all of your colleagues, ensuring each member is safe throughout. You are responsible for the welfare of that individual, so you need to provide appropriate care for anyone who appears injured. It's also your responsibility to brief the emergency services of the situation that occurred so they can respond appropriately. In security, it's our role to preserve evidence and secure witness testimonies. So, following physical intervention, whoever was involved needs to write down an incident report. Any witnesses can also give details about the incident that happened. This information is essential within court. All staff must also complete that full report individually, ensuring it is factual and there's no colluding to ensure all of your statements sort of line up. You must do this independently and ensure that you only give information that was true and accurate. The importance of maintaining and updating your physical intervention skills cannot be overstressed. Regular training ensures that you remain proficient in the safest and most effective techniques. This not only protects those involved in the intervention, but also ensures legal compliance and adherence to best practices. You need to maintain physical intervention knowledge and skills because legislation and best practice guidance can change over time. PI models change. And also you think about your proficiency in physical skills. If you don't practice, these will decrease over time. Then that will reduce the effectiveness of those intervention skills and then increase the risks. And there you have it. We have informed you how to reduce those risks associated with physical intervention to ensure that everyone stays safe.